stage of testing the drug before declaring it fit for human use. The country insists that it follow due health protocols. All right, joining us now via Skype from Ile-Ife, he's Professor of Pharmacognosy and former Director, Drugs Research and Production Unit, Obafemi Awolowo University, Professor Joseph Agbedahusi. Professor, it's good to have you join us this morning. I know you've been following this development with the Sputnik V vaccine. As it is right now, the vaccine from Russia is not amongst the list of 6 by WHO that have reached the 3rd phase of clinical trials. But Nigeria has taken delivery of this vaccine. What concerns do you have as someone who is really detailed and who has understanding of these?
Good morning, Nigeria. Thank you for inviting me. It's really very, very distressful to hear that Nigeria has received this drug. The World Health Organization had listed 6 vaccines for testing. This Russian vaccine is not one of them. And this Russian vaccine has not undergone the 3rd phase clinical trial. You see, in drug development, there are 4 phases. You have the phase 1, phase 2 preclinical trial. You have the phase 3, which is where you test on human subjects. This drug is yet to be tested on human subjects. The only thing that we heard is that the Russian president said it's good for when his daughter was treated with it. That is not enough. In fact, in phase 3 clinical trials, we use millions of people because the inherent danger in not testing a drug very well is so enormous. If I may just, to those people that are in this area, the case of thalidomide in the 60s, you find out that this drug was used, even they did the clinical trial but they did not test on pregnant women. And as a result of that, after they started to administer the drug, many of the children, they had congenital malformation. Their limbs did not develop. So they had to withdraw this drug. And even that of vaccine is even more dangerous. You find out that vaccine administration, it helps in it's better for children.
All right, just allow us butt in here. We understand that this vaccine has not gone to phase 3, which is the real place where everyone gets to know that the efficacy of vaccines. But Nigeria also received the Madagascar cure at some point and subjected it to testing through NAFDAC. What should be Nigeria's attitude towards this Sputnik vaccine from Russia?
The fact still remains that when we accepted that Madagascar remedy, it was subjected. This very, very vaccine, it's adenovirus. It is obtained from influenza, so it is not actually from COVID-19 virus. It's not from this SAR virus. So you find out that it is just a matter of conjuncture. Though the Russian president said it worked for his daughter, but that does not mean that it has worked for everybody. And moreover, like I was trying to say, vaccines are better for children, not for adults. And if you see those people that are really, that this coronavirus affects more are the adults than the children. The ability for adults to develop antibody against this antigen that is introduced through the vaccine is not as effective as that of the little children.
All right.
So that's why I believe that we must be very, very wary in the use of this vaccine. Let us wait. And which lab are we going to do it? They said at NAFDAC and at NIPRID. Do they have this P4 laboratory? Do they have the COVID virus? Do they have it? That you are going to subject it to the empirical investigation. So I'm really worried.
All right, Professor. Now, the point there is Russia has declared that by October, they'll be ready for mass vaccination in their country. Should the world wait to see the action and reaction of that and the outcome of that to maybe key in? Because they have also gotten the information that about 20 countries are on the queue to purchasing or requesting for the Sputnik V.
Let me tell you, Russia said by October. We are in September. And that is what we should guard against. Is Nigeria going to be used as guinea pig for the investigation of the efficacy of this vaccine? What are the implications? In case the thing is dangerous to human health? How are we going to? And you know, there was one European scientist that said that when the vaccines comes out, they should come to Africa. And the Director General of the World Health Organization was really annoyed at this. Is Africa the guinea pig? So let them try it in Europe. Let them try it in America. Let them try it in Russia. There they are bringing it. And see, not in Nigeria.
Okay.
And you know, Nigeria is a very stable. We have a population of 200 million. So right. Nigeria should not subject our citizens to the testing of this drug. I'm not really happy about it.
All right.
Now, there's a lot of controversy surrounding this Russia vaccine. Why would you not know the effectiveness criteria that Russia used? So when it comes to vaccine development and distribution, what is the measure of efficacy?
Thank you very much. It has to be tested. That is just it. And once it's tested, and that's why one goes through the phase 3 clinical trial. That is when it is tested on humans. You have 4 phases in drug development, whether drug or vaccine or whatever. You have the preclinical trial stage when you use experimental animals. And so if it is effective there, you do the toxicity there. If it's effective, then you move to the 3rd phase, which is the clinical trial phase. And it is the very, very important and one of the most important stages, because this is when you test it on human subjects. So a drug can be efficacious, but what of the level of toxicity? What is the safety that goes along with the efficacy? And even in this Russian one that we are talking about, it has not yet been tested. Russia said it's going to test it in October, and they have brought it to Nigeria has received it. Does it mean that Russia is going to test her vaccine in Nigeria? Or why don't they test it in their country? Why don't they test it in America? Why don't they test it in Europe? Yeah, the incidence of COVID-19 is very, very much. So, you know, coming to Nigeria, that is the issue. So, and these vaccines generally, testing vaccine on an adult it is really dangerous because the immunity level of an adult is low compared to that of children. Yes, the thing might be effective to the daughter of Putin, but that does not mean that when it comes to an adult, that it will be effective.
All right, Professor. Yeah, Professor, let me interrupt here a little bit. Is it clear how long it would take for now? Because we understand NAFDAC is still going to pass all that through some tests to make verifications. Is it clear how long it's going to take before NAFDAC comes out with the result to ascertain whether we can use it or not use it?
Well, with NAFDAC, I don't know how they are going to carry out tests because we don't have a P4 laboratory or P3 laboratory where such tests can be done. But we, in our area, we are using in silico computational study to be able to see our drug, potential remedies, medicinal plants, whether they are binding properties with the protein, CPMRS and the purine protein. And these are the proteins that are actually responsible for the COVID-19. That is what we are doing. And I think that is even more reasonable than whatever that they are doing. We don't have P3, P4 laboratory in Nigeria. We want to collaborate with our partners in Germany. It is gratifying to note that University of Ibadan and another university I had this morning, that the federal government is making them to collaborate with UK, King's College London, and things like that. That is the way that I see that we can do this. Because in Nigeria, we don't have this facility.
Professor of Pharmacognosy, Joseph Agbeda-Unzin, thanks for talking to us.